Welcome to Deuk Spine Institute, live stream October 23rd, 2025. Our patient has two problems. He has a recurrent disc herniation, meaning we fixed his disc before he reherniated, and he has also a facet joint pain. So we're going to work on both today. We're going to repair a recurrent disc herniation, L3-4. We're going to try to fix a disc herniation, L4-5. Can I get started? And then we're going to treat his facet joints. We'll just do one stream, Henry, just to keep it easy.
Copy that.
For today, since it's such a long day. It's our last surgery of the day. Our other patients have done very well. They're already gone home. No, I don't need evocative. All right, so if you have questions, feel free to ask me during the surgery. Shot. All right, that's too high. We need to come down lower. Luis, you tricked me. Shot. All right, so there's 4-5. There's 3-4. Henry, where are we at?
At this moment, no current questions.
Why don't we get started by showing the audience the different causes of back pain?
Of course.
Meanwhile, I'm going to get into these, hopefully get into these two discs. I'm going to start, my God, 4-5. Look at that, Jordan, huh? Let me start at 4-5. I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the FACET joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Is that it? All right, welcome back. Our patient, Sean, has a recurrent disc herniation at L3-4. We are in, he's moving around a little bit. I'm okay with it if you're okay with it. We're in above at L3-4. We got the needle in. We're great. At L4-5, I was able to get right to the back of the disc herniation. That's where I am now. And he has very bad stenosis here. He's been having a lot of leg symptoms, left leg, AP, first AP. And pain down the leg, can't stand for long. The pain is horrible. Weakness, numbness in his left leg. So when I originally saw him, I tried to do the left L4-5 disc, but I couldn't get in because of all that extra bone that's there. It was blocking me, and it's trying to block me right now, actually. But I can't even wiggle this around because there's no room. It's so bad. But I think I can get in and fix it. So I'm going to do my very best to get in and fix it right now. Oh, that's not going to work. Let me see. Yeah, so the actual disc is just not letting us in. It's forcing the dilator to go down away from the disc. Go ahead. Vice grip. Jesus. Yeah. While we grab that, we've shown the 30 causes of back pain.
Yes, we have.
Let's show the audience how disc can be so painful.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. We're going to show you in a moment how we fix injured discs like the one we're about to fix. We just tried to get into L4-5 again. I couldn't get into it last time. The problem is he has a high iliac crest, so I can't start lower and go straight across. I have to start higher and aim down. by aiming down and combined with that giant facet joint, it's just pushing my tools away from the disc. I'm not able to get in. So I'm just going to go back to fixing L3-4. We'll do our facet treatment. I just may try one more time at 4-5 when I get done with this one. Shot. Any questions, feel free to ask. In the meantime, show the audience how the Deuk laser disc repair procedure is performed.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. From our video, you see we're going to use the laser to go in and clean out this tear and herniation. This was pinching his nerve in his leg, so I'm going to start taking all the pieces out. We are inside the tear and herniation. Every little piece I take out gets more pressure off of the nerve. The nerve we're talking about is called the nerve root. It's a nerve root pinching that causes leg symptoms. His left leg has been killing him. About 1% of our patients do, that's the herniation right there. You guys see it?
Yes, we do.
I just tore it. I couldn't get the whole thing out. It's too big to take out of the tube in one piece, so I'm going to have to keep pulling out little pieces at a time. 1%, 1 in 100 is our reherniation rate, and it's real. 1 out of every 100 patients. There it is. Look at this thing. And there's going to be more. I'm going to go after all of them. But you guys see the herniation here?
Yes, we
Blue
do.
toe, blue toe, blue toe. Here. There it is. You guys see it?
Yes, we do.
That thing's about 1 inch long. There's going to be more than that, though. I'm going to go back and I got to get the rest out. You look at his, oh, here's another piece. You look at his MRI. I'm going to keep all the pieces here. You look at his MRI and you can see it's a pretty big reherniation. And this is the tip of the iceberg here. Any questions?
At this moment, no current questions.
So our Deuk spine's incidence of recurrent disc herniation is literally 1%. But if you look at other surgeries, like microdiscectomy, this is a big one right here. Ah, I think I got it. Oh yeah, look at that. Oh mama, prime time. Look at this thing. Ho ho! Look at that. That is the mother lode. You see this, Berndes?
Yes, we do.
Look at this thing. It looks like we just, yes. Anyway. If you do a microdiscectomy, which is another type of spine surgery, the recurrent disc herniation rate is around, if you read in the literature, 5%, 10%, 20%, it's really going to be around 50% over the lifetime of the patient. So if you follow the patient throughout their life, not just 1 year after surgery, but their whole life, you will see that microdiscectomy reherniation rate, 8 minutes. Berndes? Microdiscectomy reherniation rate, oh sorry, 8 minutes, we got to do the facets too. So 15 total, let's just say 20. Lifetime microdiscectomy reherniation rate 50%, my opinion. Okay. Deuk laser disc repair, lifetime reherniation rate 1%. And by the way, the reherniations with our patients only happen in the first year. So once you get past your first year, there's no reherniation. I try to tell my patients, just take it easy for the first year. Okay? Just take it easy. You know? Don't do anything, lift anything heavy. Keep it light. You know? Just be thankful that your back is fixed. Good news, we found the reherniation. We got rid of probably, I don't know, I think most of it at this point. I'm going to show it all to you at the end, don't worry. But Luis is keeping track of it. We're not done with it though. There's still some more. Now, the good news is this is not one of those medial herniations where we have to get Grabzilla out, because those are more paracentral, medial. This was a foraminal herniation. You could see it on the MRI, sitting in the neuroforamen, right where the nerve root is. And yeah. It's amazing that this guy could walk around because the thing was huge. And I don't know, I probably wouldn't be able to get up and walk. He's pretty tough. Ah, another piece. How's irrigation, guys? Good? All right, now I'm going to tell you we're almost done with this thing, but we're going to then move on to his facet joints. All right? And we need laser on. Laser on. Who else is in this room? Oh, good. Good. Thank you for checking. Thank you, Jordan. Another piece of herniation right there. You guys see that?
Yes, we do.
So what am I getting at? This patient has, with reherniation, it's more than one piece. It's more like, I don't know, 15 pieces. You're going to see them all. I'm laying them out on the table so you can see them, okay? But I'm not joking. There's a lot of reherniation here. And it was in the foramen, and it was crushing his nerve, and that's why he had so much pain. So I'm almost done. I've got just a little more to do, but we got most of the reherniation out. I love this technique. It absolutely blows away every other type of spine surgery because it's a transforaminal approach, meaning we're coming through the neuroforamen. Well, the neuroforamen is where the nerve is, the nerve root. That's what people complain about. Their nerve root is getting pinched, and it gets pinched most commonly right where we enter the disc tear, which is the neuroforamen, and the lateral recess right next to the neuroforamen, just medial to it. It's those two zones that have 99% of symptomatic disc herniations are either intraforaminal or lateral recess, which is also paramedian. Same thing. It's just a little bit more lateral than paramedian. Here's some more herniation right there. But yeah, the nerve was getting absolutely crushed here. Oh, still more.
We have a question and a comment.
Sure.
Question coming from Marty on YouTube,
Hi, Marty.
saying, I was wondering what would prevent you from doing the surgeries on a patient that needs it to prevent loss of mobility?
Nothing is going to prevent me from doing surgery that's needed And Marty, if you know somebody that needs surgery, just fill out our MRI review form. And it asks a few simple questions. We get your contact information. We get what's wrong, like back pain, leg pain, weakness, numbness, tingling, all that stuff from you. And then we set up a Zoom call. And literally in 10 minutes, I can tell you, oh, look at all this herniation just keeps coming out. I can tell you what's wrong. And what's wrong with your back or leg or neck or arm. And it's very straightforward. I do this all the time. Man, a lot of herniations. I think that should be about it. Let's just take a peek. I've been surprised by how much herniation there was. But yeah, it looks like it's pretty much gone now. Just a little bit left right here. I'm going to clean that up with the laser. But there's nothing to keep me from fixing somebody as long as they can get here. You know, we have one location here in Florida, and we just need people to be able to travel here. That's really the only requirement. That needs to be grabbed out too, probably. So, just got to get yourself here. Look at that. Another piece. A good sized one. All right, well, I think we did it here with the disc. Wow, now we're going to move on to the facets. But before I do, I'm going to just make 100% sure we got it all. Wow, I mean, I'm surprised how much herniation there is here, folks. Look at this. I'm going to show you guys in just a moment. Henry, you see this?
Yes, we do.
We're not even seeing it all. Look. Look at this. Every one of these is a piece of the herniation from L3-4. Just focus the camera on that. Look at all that. That's amazing how much herniation he had, right?
Yeah. It's incredible.
He blew that thing out. Well, I hope he watches this video. And I hope he sees how much of a blowout there was. So he's a little more careful next time. Because the next time it's going to be a fusion. Irrigation. We're done. All right, we're done with that disc. We've gotten out all we can. Look at this. I mean, this is really a big amount of reherniation, right? You guys see it?
Yes, we do.
I hope you're all impressed. That's a lot. All it takes for most people is that much right there. He's got about 2 to 3 times the amount of a normal herniation. He just blew that thing out. No wonder why he was in so much pain, you know. All right, we're done here. Say bye-bye to the herniations. And we're going to move on to his facets because he's getting a lot of facet pain. It's not surprising. His facet joints are huge. He's got tons of arthritis in him. Whatever he did years ago to hurt his back, here's another piece of herniation. Whatever he did years ago to hurt his back, he injured not just 3 discs, but also the facet joints. Must have been something very traumatic. Let's staple this. And come on in with the laser, with the fluoroscope. We're going to move straight into our Deuk plasma rhizotomy. Now, facet joint pain, second most common cause of back pain. 50% of patients with chronic back pain have facet joint pain. Based on our numbers, we looked at 5,000 patients with chronic back pain over the course of a few years that we treated, and 50% of them had facet joint pain. The vast majority, about 90%, had disc pain, pain from a disc. This patient definitely had disc pain, but that wasn't his only problem. He also has facet pain. So we're going to treat his facet pain today as well as his disc pain, and we're going to go ahead and get in there and treat those facets right now. Sean? So Henry, why don't you show the audience how it is that people get facet pain?
Of course.
Injection.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, Henry, before we take the comment, let's just show the audience. Jordan, show them, shot. I'm right on, well, I was right on. Shot? Let's see. Shot? Shot? I'm right on the transverse process. You guys see that finger-like projection sticking out to the side? It's called the transverse process. And the pain nerve to the facet joint literally lives just on the medial side, shot, where I'm heading with my probe. Shot? Trying to get there, right there. Yeah, right. I know the x-ray is a bit weird. Shot? There. But, shot? Right there, right where the tip of this thing is. All right, that's one. Henry, let's show the audience how facet joints get so painful and what we do to fix them.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from our video that the facet joints do get injured. When they do get injured, they end up getting inflammation in the capsule, shot. And then over time, that inflammation in the capsule becomes shot. It becomes very painful from any kind of movement that goes on. So we've been trying as doctors for many years to find a way to cure facet joint pain unsuccessfully because we've been using a treatment called radiofrequency ablation. And radiofrequency ablation, unfortunately, does not give any permanent relief to facet joints. Shot? So at Deuk Spine, we figured out a way to do the radiofrequency procedure permanently. Shot? And that is to basically wand and cut the pain nerve. Shot? Any questions?
We have a couple comments and a question. This first comment's coming from Michael on Facebook.
Hey, Michael.
Saying, hi, Dr. Deuk. It's so amazing to
Shot.
see the removal of those large herniations. Still
Yeah.
planning to come see you soon, although sometimes have pain running down my left leg.
I'm sorry to hear that, Michael. I hope you can get here. I would love to see you again on Zoom and discuss your issues. Unless you're locally, but I don't think you're local. So when you get a chance, let's meet up again. And face-to-face on Zoom so I can see what's going on and give you some advice. All right? For anybody that suffers with chronic pain, back or neck, Deuk Spine offers a basically a free consultation, Sean, where we go in and look at your MRI and talk to you and do an examination. Yep, right there. Based on that exam, we can usually figure out what's wrong and schedule you to fix it. And by the way, we don't make people wait months to come see us. We will get you in within a week and have your treatment done within a week. Okay, 1 week. Think about that. Your life can be changed in 1 week, hopefully for the better. Sean? Any other questions or comments?
Yes. Next comment coming from Marty once more on YouTube.
Sean?
Saying, I have been told in this situation, I've been told my situation is life-threatening, yet no neurosurgeon will do the surgery unless I lose weight. My spinal cord is being impeded on in my neck.
Yeah, I will do your surgery without you losing weight. Let's be clear about that. I am a neurosurgeon. So I am prepared to do your surgery without you losing any weight. I just need to see you on Zoom. Let's get together. All right? Let's get this done. Let's stop talking about doing it and get it done. All right, one more to go. Got 1 minute. Any other comments or questions?
Yes. Next question is from Delray53 on YouTube.
Hello, Delray53 on YouTube. Welcome. Sean?
Saying, would you say that intervertebral discs are similar to cartilage you have in
Sean?
the knee, and when it wears out, it's arthritis? Can the cartilage or discs ever regenerate on their own?
Great question. Great question. I think you're right. I think it's similar, but not the same. The cartilage in the knee, can it ever wear out on its own? Or the disc? The answer is no. It's always related to trauma. Every single disc problem in the world comes from a trauma, an injury to the disc, that basically first tears the annulus. Shot? What is a torn annulus? It's a ring of connective tissue, very tough. It's basically, if you eat steak, it's that ring of connective tissue around the meat. It's white. Remember what I'm talking about? Anyway, that connective tissue, it rings around the disc and holds a jelly in the center. When you tear that connective tissue through trauma, it lets the jelly seep out through the ring, and that's what causes all the pain. And the process is through inflammation. So if you want to make the disc analogous to anything in the body, I think you're right. It's most analogous to the meniscus in the knee. All right, we're done. We fixed L3-4. I tried to fix L4-5 once again. I was unsuccessful. Why? Because his iliac bone right here, which is what your butt muscle attaches to, that bone, it goes up too high. So the only way to get to the 4-5 is to go above it and then aim down. And when you do that, there's a giant bone spur there attached to the facet joint that literally pushes me away from the disc. And I tried to get in there and fix it, I just couldn't. So anyway, long story short, I fixed his L3-4, fixed the facets, but couldn't get to the 4-5 on the left. Thanks for joining us. Any other questions or comments?
Yes. One more question coming from Delray53, once more on YouTube, asking, is there any science behind glucosamine supplements?
So I don't know if there's science behind glucosamine supplements. To answer that question, you would have to do a search. And in the United States, we use the National Library of Medicine to answer those kind of questions typically. But I am not personally aware of anything that proves that glucosamine supplements improve your health. I will tell you, glucosamine has protein in it and carbohydrates in it. So when you eat it, it gets completely digested, the same as a McDonald's cheeseburger, and they become the same thing. And they get absorbed across your intestinal lining. I will tell you this. There's a lot of nonsense out there, like supplements and vitamins that are being sold to people and not regulated by the FDA, and they're all nonsense, okay? I wouldn't waste your money on any of it. If you want to be healthy and have a healthy diet, eat a well-balanced meal, have vegetables, fruits every day, vegetables, fruits, a little bit of protein, whether it's, meat or tofu, and a little bit of carbs and a little bit of fat, like cheese. You do that, you have a well-balanced diet, you're not going to have any nutritional deficiencies. You're going to be fine. Okay? All these vitamins and supplements, I think, are just nonsense. Except vitamin C. I think vitamin C is good, but you get vitamin C from citrus fruits, so you don't really need vitamin C supplements. Just eat citrus. All right, anything else?
No current questions.
Thank you. Have a wonderful day. We'll be back next week, I think. Good.